Today I'm going to be talking about birth defects. A birth defect is a physical or biochemical abnormality that is present at birth and may be inherited or result of environmental influence. According to the March of Dimes, 1 out of 33 children in the United States suffer from birth defects annually. The birth defect I'm going to talk about is an orofacial defect. Cleft lip and cleft palate affects 1 in 700 babies annually in the United States, and it is the fourth most common birth defect. What is a cleft palate? Opening or splits in the roof of the mouth and or lip. Facial and oral malformations that occur during pregnancy while the baby is developing. This birth defect is most common in Asian, Latino, or Native American ethnicities. And as for gender, more girls have cleft palate without cleft lip, but more boys have cleft lip without cleft palate. The types of cleft lip and cleft palate include incomplete and complete, unilateral and bilateral cleft lip, incomplete, complete, and submucous cleft palate. Basically, both defects can occur in one or both sides of the mouth, and it is possible for you to have one birth defect and not the other. Cleft lip and cleft palate can cause major feeding problems, ear fluid buildup, and hearing loss, dental problems, and speech problems. According to MayoClinic.org, an ultrasound around the 13th week of pregnancy can detect differences in facial structures. Therefore, it can detect this birth defect. Having these defects may cause additional health issues. Most children are lucky to just have this, but others include Pierre-Robin sequence, Stickler syndrome, and deletion syndrome. HealthTalk.org sums up Pierre-Robin syndrome as an abnormality affecting your head and face, which includes smaller lower jaw, tongue placed farther back than normal, and a cleft palate. Stickler syndrome reduces the amount of collagen. This affects your organs and bones. This also affects your eyesight and can cause heart murmurs. The deletion syndrome occurs because of a fault on chromosome 22 and can cause unusual facial features, heart abnormalities, low immunity to infection, and low blood calcium levels. Is this fixable? Cleft lip is usually repaired at 4 to 6 months, cleft palate at about 12 months. Although both are usually treated and cured with surgery, other treatments are needed because of what these affect. Some treatment members or specialists a child are most likely to attend are ear, nose, and throat physicians, oral surgeon, orthodontist, dentist, audiologist, psychologist, and geneticist. And they also need a speech pathologist. Support, encouragement, and openness helps children accept and not be insecure about their birth defect. I myself was born with a cleft palate and endured surgery, speech therapy, orthodontic and dentist work, as well as audiologist treatment and therapies. Because of my cleft palate issue that I had and my defect, my teeth used to look like this. I have had braces twice, and I'm currently having them now because of my cleft palate issue, but I have support, and I will probably have to wear a retainer for life, but that's just one of the treatments that are available to me and that I need to do to fix this problem that will be ongoing if I don't get the treatment. So in conclusion, everybody needs support and encouragement, and they need the proper treatment and take the proper steps regarding their health. Thank you so much.